Hundreds of thousands of COVID booster shots are coming to Colorado, which raises the question, do people want them? COVID's no longer top of mind, with the weaker variant circulating and most Coloradans having some level of immunity from either catching the virus or getting a vaccine, or both. Anusha Roy has some perspective from a trusted voice.
Tell me about the booster shots that are going to be showing up in Colorado. And if I understand correctly, they're variant specific?
Yep, so they're Omicron-specific, and it's got the BA4 and BA5, which is what we've been seeing for the last several months circulating. So this one, in theory, will give you a little bit broader protection because it's more specific to what we're seeing.
With the vaccines, we've always talked about, you know, the vaccine gives you that broader protection, right, against COVID and multiple variants. Now this is a booster for a specific variant. You know, how do you reconcile those two?
Yeah, so this is what we do with flu every year. So for people that say, well, this is, you know, weird science, we've never done this, we do this every year. There's always lots of different strains of flu circulating. It's not just one. This is sort of the natural evolution of this.
What does that tell you about the evolution of living with COVID, that you're starting to develop vaccines more like the flu vaccine?
I think it's a good thing. Obviously, again, I think hopefully we're over the major hump of where people were so profoundly impacted by this. During the pandemic, we never saw flu and COVID at the same time. This year, at least again, looking at the Australian data, COVID was definitely a presence. We usually mirror what they see. Their equivalent of our November, they started seeing cases of flu skyrocket. And the number of cases was higher than it's been since probably 2009. We haven't been exposed to flu for 2 years. So basically 2 years without exposure, which means we are probably, our defenses, our army is not well trained. They've been on vacation for the last 2 years or hanging out at home. And so now our army of our immune system needs to go back to basic training and get with the program.
I'm thinking the perspective of families with kids. What should they be bracing themselves for?
I think it'll just feel more normal, or maybe a little less charged, in that when you see it, you're like, oh, this feels kind of like it did before. And it'll be novel because for 2 years, all we've thought about is COVID, 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 right?
So the CDC just agreed with advisors to recommend those boosters. Around 300,000 have been ordered for Colorado. Now, the Omicron booster, though, hasn't been fully tested on humans yet. So ultimately, that means we really don't know how effective they will be. It still has to be studied, and that's going to be after it's being rolled out to people. But health experts are saying, you know, the flu shot is actually not tested on humans year to year. It's that original vaccine that has been tested, then it's tweaked a little bit, you know, depending on the strain. The same thing is happening with these boosters as well.
I feel like in the years that we were a lot more afraid of COVID, we heard about the warning about flu and COVID overlapping in the wintertime previously.
Yeah, it's come up multiple times, and Dr. Barron said it hasn't happened, right? It didn't pan out that way. They've commingled before. We didn't see that giant surge in flu cases. This year, what could be different is that we don't have a lot of people wearing masks. The schools are back in session. We're traveling more, and so all of those factors, they're worried about how that's going to play out in the next couple of months.
Shots coming after Labor Day for anybody who wants them. Anusha, thank you.